Hello, everyone, and welcome. I'm excited to kick off today's presentation on diseases of endocrine glands, covering codes from E00 to E99. Today, we'll explore various endocrine disorders, their implications, and how they are classified. We'll take a brief journey through the key aspects of these diseases to enhance your understanding. So, let's get started and delve into this fascinating topic together. Let's take a closer look at the anatomy of endocrine glands. The endocrine system is made up of tissues, mainly glands, that produce and release hormones. These hormones are crucial because they act as messengers, coordinating various functions in your body by traveling through your blood to reach different organs. Glands are specialized tissues designed to create and release substances. In the case of endocrine glands, they produce hormones and release them directly into your bloodstream, allowing for quick and efficient communication within your body. Now, if we look at some specific endocrine glands from head to toe, the first one is the pineal gland. It's a tiny structure located deep in your brain, beneath the back part of your corpus callosum. Its main role is to produce and release melatonin, which helps regulate your sleep-wake cycle. Next, we have the pituitary gland. It's small, about the size of a pea, and situated at the base of your brain, just below your hypothalamus. The pituitary is often called the master gland because it releases 8 different hormones, some of which act on other endocrine glands to stimulate them to produce their own hormones. Understanding these glands and their functions helps us see how the endocrine system maintains balance and supports overall health. It's a key part of how our body communicates internally, and it ties into the broader theme of how our body's systems work together seamlessly. Let's take a closer look at the anatomy of the endocrine glands. First, we have the thyroid gland, which is quite small but plays a vital role. It's shaped somewhat like a butterfly and sits at the front of your neck right beneath your skin. This gland releases hormones that are crucial for controlling your metabolism, essentially how your body uses energy. Next, there are the parathyroid glands. You have 4 of these tiny, pea-sized glands located behind your thyroid. Sometimes, however, they can be found in other places like along your esophagus or even in your chest. These are called ectopic parathyroid glands. Their main job is to release parathyroid hormone, or PTH, which is essential for regulating the calcium levels in your blood. Then we have the adrenal glands. These are small, triangle-shaped glands perched on top of each of your kidneys. Despite their size, they produce several hormones that are key to managing important bodily processes. These include controlling your metabolism, regulating blood pressure, and helping your body respond to stress. Understanding the anatomy of these glands helps us appreciate how interconnected and complex our endocrine system really is, especially in maintaining overall balance and health. Let's take a closer look at the anatomy of some key endocrine organs in our body. As you know, certain organs play a vital role in producing and releasing hormones, which are essential for regulating various functions. Starting with the hypothalamus, this is a small but crucial structure located deep within your brain. Think of it as the main link between your endocrine system and your nervous system. It produces 2 hormones, oxytocin and vasopressin, which are stored and released by the pituitary gland. Additionally, it makes and releases other hormones like dopamine and somatostatin that influence other bodily functions. Next, we have the pancreas, which is situated at the back of your abdomen. It's interesting because it serves a dual purpose, both as an organ and a gland, and it's also part of your digestive system. Its primary role in the endocrine system is to regulate blood sugar levels by releasing insulin and glucagon, 2 hormones that work together to keep your blood glucose in a healthy range. Moving on to the ovaries, these small, oval-shaped glands are located on either side of your uterus. They are responsible for producing and storing your eggs, or ova. But they also produce sex hormones that are crucial for controlling your menstrual cycle and supporting pregnancy. And lastly, the testicles, or testes, are small, round organs found beneath your penis in the scrotum. They are key in making sperm and producing sex hormones, especially testosterone, which influences many aspects of male health and development. Together, these organs highlight how interconnected and complex our endocrine system is, working behind the scenes to regulate many vital processes in your body. Let's take a closer look at some common diseases that can arise from endocrine gland disorders, starting with diabetes mellitus, which actually has two main types, type 1 and type 2. Both involve issues with insulin production or utilization, leading to high blood sugar levels. It's one of the most prevalent endocrine disorders worldwide. Next, we have thyroiditis, which is inflammation of the thyroid gland. This condition can cause symptoms like pain, swelling, and hormonal imbalances. Sometimes it leads to hypothyroidism or hyperthyroidism, depending on the nature of the inflammation. Following that, Graves' disease is another thyroid disorder, but it's characterized by an overproduction of thyroid hormones, resulting in symptoms like rapid heartbeat, weight loss, and bulging eyes. It's an autoimmune condition, which ties into how immune responses can impact endocrine function. Cushing's syndrome is caused by excess cortisol production, often due to adrenal or pituitary tumors. It can lead to symptoms such as weight gain, especially around the abdomen and face, as well as skin changes and muscle weakness. Obesity, while often associated with lifestyle factors, can also be linked to hormonal imbalances, such as those involving insulin, thyroid hormones, or cortisol. Endocrine dysfunctions can significantly influence body weight and metabolism. Then there's acromegaly, which results from excess growth hormone, usually due to a pituitary tumor. It causes abnormal growth of bones and tissues, leading to enlarged hands, feet, and facial features. Lastly, dwarfism, especially when caused by growth hormone deficiency, results in significantly shorter stature. It highlights how hormonal deficiencies during development can have profound effects on physical growth. These diseases really underscore the vital role of the endocrine system in maintaining overall health and how its disruption can lead to a wide range of health issues. Understanding these connections helps us appreciate the importance of proper endocrine function in our bodies. Diabetes mellitus is a condition that occurs when your blood sugar, or glucose, becomes too high. This happens because your pancreas isn't producing enough insulin, or sometimes no insulin at all. Alternatively, it can be due to your body not responding properly to insulin. It's important to remember that diabetes can affect people of all ages, from children to older adults. Now, when we look at the different types of diabetes mellitus, we see some key differences. Type 1 diabetes typically affects children under the age of 12. The symptoms often include weight loss, increased urination, constant hunger, and feeling very tired. On the other hand, type 2 usually affects individuals over 12 years old and tends to develop gradually. Its symptoms also include frequent urination and hunger, but often include excessive thirst. The causes of these types differ as well. Type 1 is often linked to infections and environmental factors, which can trigger the immune system to attack insulin-producing cells. Meanwhile, type 2 is more related to lifestyle factors like gaining weight and experiencing stress. Understanding these differences is crucial because it helps us tailor prevention and treatment strategies accordingly. It also ties into the larger picture of managing blood sugar levels and reducing complications associated with diabetes. Let's take a closer look at the different approaches to treating diabetes mellitus. First, we have oral hypoglycemics, which are medications taken by mouth to help lower blood sugar levels. These are often the first line of treatment and work through various mechanisms like increasing insulin sensitivity or reducing glucose production. Next, we have injectable insulin, which is essential for many patients, especially those with more advanced diabetes. Insulin injections help to directly regulate blood sugar levels and are tailored to each individual's needs. Then there are non-insulin injectables. These include newer medications like GLP-1 receptor agonists, which not only help control blood sugar, but can also promote weight loss and have additional cardiovascular benefits. Connecting this to the overall theme, it's important to understand that treatment options are quite diverse, allowing us to personalize therapy based on the patient's specific condition and lifestyle. Each approach plays a vital role in effectively managing diabetes and preventing complications. Let's talk about the guidelines for coding diabetes mellitus. The codes for diabetes are actually combination codes, which means they include information about the type of diabetes, the body system affected, and any complications involved. It's important to assign as many codes from categories E0, 8 through E13, as needed to fully capture all the conditions the patient has. Now, regarding the type of diabetes, remember that a patient's age isn't the only factor. While most type 1 diabetics develop the condition before puberty, the key point is that age alone isn't the determining factor. Because of this, type 1 diabetes is often called juvenile diabetes. If, however, the medical record doesn't specify the type of diabetes, the default code is E11, which stands for type 2 diabetes. Finally, when it comes to diabetes management, it's essential to note that the condition may be managed with insulin, oral hypoglycemics, or injectable non-insulin drugs. All these elements are important for accurate coding and, ultimately, for ensuring proper treatment and documentation. Let's look at the coding for long-term diabetes management. When documenting, we assign specific Z79 codes that reflect the patient's ongoing treatment. First, we start with the code from the E11 category, which indicates type 2 diabetes. Then, we move to the Z79 category to specify the type of long-term therapy. For insulin, we use Z79-4, which stands for long-term insulin injectables. For oral hypoglycemics, the correct code is Z79-84. And if the patient is on both insulin and oral medications long-term, we assign both Z79-4 and Z79-84 to accurately capture their treatment regimen. However, it's important to note that Z79-4 should not be used if insulin is only given temporarily, for example, during an episode to control blood sugar, rather than as a long-term therapy. The goal here is to clearly document the ongoing management, not short-term adjustments. Highlighting the key point, proper coding ensures we accurately reflect the patient's long-term treatment plan, which is crucial for proper documentation, billing, and quality reporting. This connects to our overall theme of precise coding practices to support effective patient care. When it comes to complications from insulin pump malfunction, one key issue is underdosing of insulin. If the pump fails, it can deliver too little insulin, which can be quite dangerous. In terms of coding, this situation should be classified under subcategory T8056, which covers mechanical complications of specific internal and external prosthetic devices, including insulin pumps. It's important to specify the exact type of pump malfunction in this code to ensure accuracy. The underdose itself should be coded with T383X6, which indicates an underdose of insulin and oral hypoglycemic drugs. And don't forget, it's essential to also assign additional codes for the type of diabetes the patient has, as well as any related complications resulting from the underdosing. Connecting this to the overall theme, understanding these coding guidelines helps us properly document and manage the potential risks and complications associated with insulin pump use. It ensures we're accurately capturing the clinical scenario, which is vital for treatment, billing, and patient safety. Let's talk about some important guidelines related to diabetes mellitus management and complications. First, in cases where there is an overdose of insulin due to a malfunction of an insulin pump, it's crucial to code this correctly. The primary code for an encounter caused by an insulin pump failure resulting in an overdose should be T8056, which indicates a mechanical complication of other specified internal and external prosthetic devices, implants, and grafts. Followed by that, we should use T383X1, which specifies poisoning by insulin and oral hypoglycemic drugs, and this is considered an accidental poisoning. Moving on to secondary diabetes mellitus, it's important to recognize that this form of diabetes is caused by other underlying conditions, such as diseases, medications, or procedures. For these cases, we use specific codes under categories E08, E09, and E13. E08 covers diabetes due to an underlying condition. E09 relates to drug or chemical-induced diabetes, and E13 is for other specified types of diabetes mellitus. These codes help identify and document the complications or manifestations associated with secondary diabetes. Understanding these coding guidelines is essential because they ensure accurate documentation and help in managing and tracking different diabetes-related issues. Remember, secondary diabetes isn't just a primary condition. It's caused by something else, whether it's a disease, a medication, or a medical procedure, so proper coding reflects that relationship clearly. This helps us provide better care and facilitates more precise research and epidemiological tracking within the broader context of diabetes management. Let's go over some important guidelines for coding diabetes mellitus. When the diabetes is due to a disease, you should start with the code for the underlying condition first, and then follow it with the E08 category. This helps accurately reflect the root cause of the diabetes. If the diabetes is caused by drugs, the approach is slightly different. You need to first code the drug overdose, which falls under the T35 to T50 category, and then add the E09 category for drug-induced diabetes. In cases where diabetes develops after a pancreatectomy, such as post-pancreatectomy diabetes mellitus, the key is to assign code E891, which stands for post-procedural hypoinsulinemia. Additionally, you should assign a principal or first listed diagnosis from category E13, which covers other specified diabetes, and include a code from subcategory Z9041, indicating the presence of a status post-pancreatectomy. These guidelines are crucial because they ensure that our coding accurately captures the underlying cause and context of the diabetes, which is essential for proper documentation and treatment planning. Remember, the sequence matters a lot here to reflect the true clinical picture.